narcissists often only seek therapy when their life's honeymoon phase takes a nosedive. However, can therapy actually address narcissism and help a narcissist? The short answer is yes. Narcissism is a personality disorder, or the way the person thinks and behaves, but are largely based on their beliefs. Thus, narcissism is part of them. However, there are effective treatments for NPD. But then why don't most narcissists change? And why do people believe a narcissist can't change? 3 problems. The first problem. Most narcissists avoid psychotherapy or quit prematurely when they start to feel threatened or uncomfortable. This is because to heal, they need to dismantle their false self that serves as a protection for them against feelings of shame, guilt, inadequacy, and worthlessness. Thus, the main problem is that the narcissist just does not want to change because it's an emotional rollercoaster ride for them. Low-functioning narcissists, or those who use fear and violence to control, just flat out refuse to work on themselves or change their behaviors. They will often curse at the therapist and use any excuse they can to get out of there. If they are forced to stay, they are extremely difficult to work with and easily triggered to the point that they can attack the therapist. High-functioning narcissists, especially highly intelligent narcissists, often know exactly what they do and go to therapy to learn how to hone their craft, as well as play games with a therapist. They see it as a sport to try to outsmart and manipulate the therapist. They often become even more manipulative and mentally abusive. They frequently claim they learned in therapy that you are the problem and that they now know what is wrong with you. They will then use the supposed knowledge they learned in therapy sessions to diagnose you and use that as an excuse to abuse you even more. The mid-functioning or mid-intelligent narcissist is more often willing to go, as they try to be nice to you or to stop you from leaving them. However, they honestly think they are a nice person and that you are just being unreasonable or overreacting. They too don't like to deal with their past and often only go to find excuses for their behaviors or reasons to blame you for their behaviors. Thus, most narcissists who go to therapy have no intention at all to change any of their behaviors. And while the narcissist is in therapy, they almost get a free pass on abusing you, as they can just claim they are working on their behaviors and anger. Thus, they have little incentive to change, as they can blame you for not being supportive, and then in therapy, blame the therapist for not being a good therapist. They now have 2 people they can blame for their behaviors. The second problem. Trained and experienced therapists who can deal with narcissists are scarce. Few psychotherapy training institutes focus on teaching the diagnosis and treatment of NPD, but instead focus on training general practitioners, not specialists. To become a specialist in this field is expensive and can take at least 3 years of additional advanced training. Therapists mostly get paid the same for all their clients, no matter their issues. Thus, a therapist needs to spend a lot of money to train for years to deal with very difficult people who often do not want to change and frequently insult or humiliate the therapist, all for the same rate as say treating someone who wants to quit smoking. Thus, there is little incentive for therapists to work with narcissists or even learn how to. And as the narcissist often does not know their underlying issue to their problems is their narcissism, they often end up with psychotherapists who may not recognize that they are dealing with NPD. So the narcissist often gets diagnosed with some other disorder, and even if a therapist realizes their client is a narcissist, they may have no idea how to treat narcissism. The third problem. Most people underestimate the amount of time and work it takes to change your personality. And narcissism is extremely resistant to change, as it is a protection mechanism for the narcissist. They created their false self because they have a fractured and underdeveloped true self. But you cannot just remove a false self, as there's nothing underneath. They need to slowly dismantle the false self while they are building up their true self. Thus, each behavior and thought needs to be replaced with a more socially accepted thought and behavior. And then they need to constantly practice this new thought and behavior until it becomes a habit and replaced the old behavior or way of thinking. It takes a lot of time and work. A full psychotherapy of NPD generally takes at least 5 to 10 years of dedicated work. Therapy is most productive if a client sees a therapist once a week. So to put it in perspective, it's going to take at least 260 to 520 or more sessions to address narcissism. And if there are other mental health problems, which is often the case, they often need to be addressed first, which can easily add another 3 to 4 months per issue before any meaningful work on narcissism can be done. Addressing NPD is a long, slow, and complex process with several stages, and clients can stop at any point. High-functioning narcissists who are self-reflective and cope with most parts of their life well are likely to do better in therapy. Lower-functioning narcissists who are unable to keep a job and have no friends, or who use physical abuse, often progress very slowly. Covert narcissists often struggle with self-esteem and depression and can take a long time to change. If a person is vindictive or derives pleasure from other people's misfortune, then it is a lot more difficult for them to change, and therapy may take a lot longer or fail. Most often when a narcissist stays in therapy, it is because they want to understand their triggers so that other people do not cause them as much pain. So it is still all about them and lessening their pain. Empathy for others and their impact on other people often can only be addressed in therapy after the narcissist has learned and implemented new coping strategies for their triggers. So even if a narcissist goes to therapy and puts effort in, it may be years before they start showing empathy towards you. It can happen that a narcissist goes to therapy for years and learn how to cope better with their triggers, which makes them a happier person. And then they decide to stop therapy as they see no value in changing their newfound happiness to make other people happy. Thus, the narcissist might change into a very happy jerk who still abuses people and ruins their lives. Watch the video suggested to you now to learn the 11 common gaslighting phrases narcissists use to mess with your mind and control you.